we're at 3:01. A couple of announcements here. We're waiting for people to get on. So our next call is going to be November 11th. We're going to talk about building your breastfeeding task force and kind of some overcoming kind of attrition with when nurses come and go. It's actually going to be at 11 a.m. instead of our usual 3 o'clock slot because we've had some conflicts that day. Anyway, 11 o'clock on November 11th, and I'll send out a calendar invite. Here's statistics for any of you that are in the development stage or later. They're all due to me every month by the 15th, so that's coming up tomorrow. So if you haven't sent me your stuff, please email on. And a happy note is that yesterday, Comanche County was designated, they received their official word, they've been designated baby-friendly. For hospitals in the baby-friendly designation. So that's wonderful. I think that we have, well, she just came. Okay, so looks like she's still working on getting her audio connected. What I'm going to do is I'm going to go ahead and turn things over to Kamisha Busby. Kamisha is Central Oklahoma Healthy Start Initiative, and I'll tell you her exact title. She is going to go from there, and then anyone who is on the call, if you're not actively speaking, if you can mute yourself, that would be appreciated so we don't get kind of bleed over. Okay.
Yes, ma'am.
Okay, I'm going to let you tell me what to do. You just tell me next slide, and I'll hit the button.
That works. Good afternoon to you all. How are you doing? Okay.
Okay, sorry.
No, I just hope you all are having a good afternoon on this Wednesday. I'm Ms. Kamisha Busby. I've actually been with Central Oklahoma Healthy Start since July 20th as the role of program coordinator. So new to the maternal child health world. I'm new to this program, and I'm very excited about the initiative that we have. So on our team here at Central Oklahoma Healthy Start Initiative, we would like to welcome you all to this webinar to get to know more about what we do. The webinar is to keep the Healthy Start model in our efforts in strengthening our community and bringing more awareness to the program and the service that we offer. Please. All right, the purpose is to provide an overview of the Healthy Start program to our community partners, looking at it in the historical perspective, a discussion of Healthy Start 1.0 and 2.0, and discuss the program or Healthy Start 3.0, which we call that. Discuss the Central Oklahoma Healthy Start Initiative program and provide information on professional and organizational development opportunities that we offer. Next slide, please. We'll be presenting to get about the Healthy Start 1.0 and 2.0, adapted from the reflections of the history of Healthy Start Initiative. This will be presented by Dr. Middlecheck on December 10th and 12th. So a lot of these slides that I will cover in the history, it comes from his research and his presentation. Next slide. Okay, so Healthy Start began a presidential initiative in 1991 as a demonstration project. It was on other infant mortality initiatives from 1965 to 1987, and on the slide. There was the White House task force that was set up to look at reductions in infant mortality in 1998. Healthy by 50% in 5 years. Also include a national evaluation of its successes after the 5 years. To address 50 awarded Healthy Start grants, which is Baltimore, Maryland, Birmingham, Alabama, Boston, Massachusetts, Illinois, Cleveland, Ohio, Detroit, Michigan, Pittsburgh, Plains, Nebraska, North Indiana, Oakland, TD Health located in South Carolina, and Philadelphia, Pennsylvania, Healthy Start. Next slide, please. The overall was to focus on a community-driven strategy where they actually identify what they felt the causes of infant mortality in their particular community and ways to try to reduce that. So, community commitment and involvement, increased to care, integration, and promoting personal responsibility. Some components initially were the consortium to submit. There was a service system plan, a business on public information and education, and also evaluation. At the time, HRSA also included local evaluators. There were 9 individuals. Their communities were allowed to come into and request as they identify the needs in their particular communities to reduce infant mortality. They were the care management, outreach, and recruitment, the family clinical services, risk reduction, facilities such as transportation and child care, training, education, and adolescent services were also added. Next. The movement became authorized in 1998 as a part of the Title V legislation, which was the National Healthy Start Association. Prior to results, Healthy Start began its growth in 1996. Small decisions, and that we brought into a large number of Healthy Start programs between 1996 and 97. The also showed some professional implementation and prenatal care or limited impact on birthing outcomes or disparities. I just want the association founding to a different direction. Next. They began to focus on politics of the program, not just the service delivery. The health initiative, strategic investment and policy options. Mel Colt, SP, Chuck, and Amy founded a reference tier, and they did a study on analysis of Healthy Start programs and create specific recommendations, and it was rebalanced the federal leadership. So over time, this became what we call the 2-time period, and this provided direction. It was reproductive health, but placed an emphasis on what should be implemented and needed in high-risk community. It is conception to 2 years of age. It orders initiatives are 3 core ideas and 9 required components. It also enables the local health system action plan, sustainability, and linkage to Title V. It also brought a consumer community voice to efforts to improve maternal and child health through the consortium, and institutionalize and provide new and improved content focus, such as the direct health services content and provisions of the interconceptual care collaboration, depression, and treatment, and referrals such as father involvement and pregnancy health, as well as disparities came out as we involved the Healthy Start second wave. The Healthy Start program was established, like I said, as a presidential initiative in 1991, and it began a 5-year demonstration project. Communities with high infant mortality rates and other perinatal outcomes. It was really focused on community innovation and creativity. And over 90% of Healthy Start sites were implementing all 4 components of the program. Most services and care outcomes significantly improved. The pace, along with and coordinated efforts in support the priorities such as the maternal, infant, and child programs and need-based grantees such as Head Start, fatherhood, and breastfeeding activities in collaboration with the CDC and the NIH, NAVI AIDS strategies, and screen sickle cell disease to maximize Healthy Start on reducing infant mortality by integrating current and emerging evidence-based approaches. Slide. Currently, we have 100 Healthy Start sites in 34 states. Just in we actually have 4 Healthy Start initiatives. The Central Oklahoma Healthy Starts, which we service in Logan County. We have Healthy Start in any racial and ethnic disparities, and theirs is listed in parentheses. We have Healthy Start Community Council, which is in Tulsa County, and then the Health Department eliminated disparity in perinatal health with the following zip codes. The program is accountable, but not only for its clients, but for the entire community, and expand on population health, not just focus on patients, but on the health of the neighborhoods and communities, equality, competencies, and standardized interventions, and expand to improve women's health, not just during pregnancy, but before and after as well. Again, the future child, and on family resilience to address some of the stresses that underlie many disparities in birth outcomes. The Healthy Start model that was added, and women's health, quality service, strength, and family, achieving collective impact, and increasing accountability through quality improvement, performance monitoring, and evaluation. Next slide, please. They combine skills from individuals at varying levels and backgrounds, which include social service programs, so skills set, and well-versed area of public health issues. Healthy Start program sites, we find that most team structures include the following: a program director, a program coordinator, and staff, which is comprised of community health workers, caregivers, clinical and non-clinical health educators, coordinators, local, and then the liaison, which supports the implementation of the Community Action Network. For Central Oklahoma Healthy Start Initiative, our Healthy Start program was established in 1999, originally serving specific zip codes, such as one of the Healthy Starts in Tulsa within the county. Under this new Healthy Start 3.0, a new grant that was received by our Healthy Start program in November 2014, we now serve all of the Oklahoma County, Logan counties, and other areas that are not linked to a Healthy Start program. Within our consists of a program director and a program coordinator, which I serve. Our staff consists of 1 educator, 5 caregivers, 2 out, and 1 program assistant. This has been together for a long time, with one of the case managers being with our program for over 16 years. I believe before she kind of introduced herself and said she was the rocking chair of the program. With that, is well diverse in Healthy Start affairs. The roles and responsibilities of the frontline staff include assisting with program reach, Healthy Start activities, recruiting program participants that include women, both preconception, prenatal, interconception, and parenting phases of their life, infants and counterparts. Provide case management services directly to serve the clients enrolled in our program, and they provide individual and or group education services that come in a variety of formats. Next slide. Listed here is the overall benchmarks needs published by the end of our grant year, which is for May 31st, 2019. Breastfeeding is one of our specific focuses, our location during this grant period. In this slide, I would like to expound upon the 5 approaches of Healthy Start and how we work with the community and community partners. The program is to improve women's health. The approach are facilitated mainly through our case management services, which is vital for us to work directly with the women, children, and fathers who interact with the program. Some of these we assist with include support families through enrollment into health insurance programs. So we are highly supporters, have on our can enroll our clients in ACA. Assist with reproductive life planning to promote birth space and support of prevention activities, and also quick coordination or facilitating access to healthcare services for the women that serve, are things that we do to improve women's health. And we'll focus on patient-centered medical homes. A little caveat to that is we are a facility of community health centers, but we do make sure, if a family does not have a home, we have those direct to get them linked to a medical home, but if they do, we'll still work with them and make sure they get the services that they're needed with whoever they select. Approach is to promote quality service, and our frontline staff do this through service coordination by linking participants with other community activities or services that are provided via health, social health service programs. Connecting with these partners and organizations that serve the same population as the Healthy Start program serves. Our teachers were provided with training on breastfeeding under Becky Mennel's training, but do understand linkages and referral for comprehensive breastfeeding programs when assistance goes beyond what our expertise are. So we work closely with the breastfeeding support group. Approach is to strengthen family resilience, and our frontline staff assist participants with improving their skills, effects that stress can have on the family, and by promoting a trauma-informed care, and lastly, by promoting involvement of fathers in infant and child development. Next. I'm sorry, can you go back? Just one. Okay. Collective impact. The 4th approach is to achieve collective impact, and we do this by promoting and supporting community collaboration and engaging program participants in our Community Action Network meetings, and to make sure that their voices are heard so that the program can be refined to address their needs. Every day is at 10 a.m. at the Infant Crisis Center located off of Lincoln Boulevard. So those of you all who are interested and want to know what we do more with the Community Network through Oklahoma Perinatal Coalition, you're more than welcome to come out. Our next meeting is scheduled for October the 22nd at the same time, but the change in this meeting is due to our local evaluator doing a presentation. We encourage you to join. Any community representatives that you know as well you would like to join, please. The final approach is to increase accountability through quality improvement. improvement and evaluation. It's critical that we understand the importance of quality improvement in the QI process. A fee is improving the implementation of our Healthy Start program by looking at the data for quality improvement and program involvement. That data to show program impacts on the local level. This is completed by our local evaluator and presented on a national level. Few slides will cover the outreach and programs that we offer through Central Oklahoma Healthy Start to our community and our participants that we have families through the program. The first one is when we have Governor Mary Fallon come out and tour Healthy Start and information about what the initiative was on, so she can actually see everything for herself to do for maternal child health. Next slide. This slide is our Fatherhood Initiative, photos from Fatherhood Initiative. Healthy Start looking at holistically at the family, but also to assist the father or father-to-be on skills building. We partners like DHS to discuss support and visitation, have a behavioral health staff to discuss trauma within their family, which includes but not limited to workforce development, substance abuse, and mental health. Next slide, please. Our educational sessions that we do have for our participants include breastfeeding, parenting skills, care, infant and child care, and safety, women's development. Currently, a representative from the Single Parents Network works with our participants every Tuesday from 1 to 3 using the Restart program. The program is a 12-week model that focuses on support and resources to assist the single parent or guardian as they raise the child. Next slide, please. Over our holiday events, we have yearly events for our clients in the community just to show our appreciation for them and their. That's just some photos from those. This slide is our day at the zoo. This focuses more on physical fitness and healthy living for our families. So we have to all of our families that were participants, but then also their extended families that were able to come out as well. Next slide. Being a and working with community partners. So some of the events that we have our meet and greet. That will be Friday, October 30th from 11:30 to 1. At that time, that's a revolving door where you can come in and meet some of our staff, see where we're located, learn about the programs that we offer, any type of questions that you may have, or you just want to see for yourself, we welcome you all to come out. And after that meet and greet, we have our Harvest Fall Fest. That is our community and our community participants from 2:30 to 4:30. And so we actually want children to dress up in costume and come out, and we have healthy snacks and goodies. So our focus month in domestic violence, so there will be presentations and information handed out on those topics. Next slide, please. This slide, we have two different, I couldn't decide which one to put up, but we have two different flyers. This is a program quarterly at Central Oklahoma Healthy Start. We partner with Safe Kids Coalition, and we do a car seat safety event. So it depends. What we're finding is that the proper seat for their child. So just for $10, offer that to them. They get a brand new convertible seat. It ranges anywhere from 5 pounds all the way up to 40 pounds, so it actually grows with the child. That's something that we're actually doing on November the 30th here at Central Oklahoma Healthy Start. Do you know much more about the Healthy Start initiative? Want to know more information? not capture in this presentation. These are good resources. We were listed here, then also too, we're program we have HRSA Healthy Start. That's a direct link to find out more about the national initiative. We have the National Healthy Start Association that's also listed as well to get a wealth of information about Healthy Start. Next slide, please. And outside questions or concerns, these are this is my contact information. I'll be more than happy to answer what you may have. Any questions you all have for me?
I started asking a question and I was still muted. I have a question about qualification for the program. Maybe you criteria to qualify.
To qualify for our program is in conceptual stages of life. So she's looking for family planning. We're able to take her in. We're actually able to take in pregnant or a baby, or you have an infant child from birth all the way up to age 2. And then also if we have a father of the baby. So if we have an expecting father or a father that has a child, they go as well.
There are no income requirements. Anybody?
No, ma'am. There's no income requirements. It's pretty much there's no barriers outside of what I just listed of who qualifies, regardless of insurance coverage or not coverage. We have that.
Great.
Questions that you have?
At Integris Beth and Enid. Since we're in Garfield County, we were involved in this, right? Until you said Logan in Oklahoma.
But if we can find, with you being there, if we can find a Healthy Start program that's closely related to you, we can hook you up with them. And if that means it's us, we can actually come out and help as well.
Thank you.
I know local coverage seems to be a hot topic, even internally with us with the new group. We service anybody if they do not have a Central Oklahoma Healthy Start in their area, or link them up to services, whoever's close to them. The only difference is we can help when it comes to data collection that we need to do as far as reporting with HRSA. They want in our numbers, there just be more of community participants, which is still we don't do anybody.
Mm-hmm. Okay.
Your question.
Thank you.
Isn't there also a Healthy Start program in Tulsa area?
Yes.
Oklahoma, but this is something that is a resource wide, just may not be Kamisha or her team.
Right. If you ever have any questions, I mean, I can be a resource and I can point you in the right direction or even make that connection. I converse with Tulsa a lot. So. Yeah, y'all wanted to add? I know there's many.
Great job.
If anyone has any other, if anyone have any questions for me or about Become Baby Friendly? Anyone anyway, okay, so, well, if we don't have any more questions, then we'll wrap up. But just again, a reminder that our next phone call is November 11th, 11 a.m. And those of you that are in the development stage or further, your statistics are due to me tomorrow. So if you have questions, you can email me or call. And again, just want to congratulate Comanche County. I don't think Comanche County is on the phone call, but want to congratulate them in receiving word yesterday that they are officially baby friendly. So thank you so much to Kamisha and to your team. Thank you so much for participating and contributing with us. We appreciate it.
Thank you for having us on, and thank you to as well.